Today we're going to talk about psychoanalysis, psychodynamic theory. Freud, we're going to talk about Freud. We're going to talk about Erickson. We're also going to talk about Margaret Mahler, who was she's from Hungary, actually, and moved to the United States eventually. But hey, let's go ahead and get into it so that we can get through. There we go. Well, we'll see what happens. Okay. This is not Freud. It's not. It's not Erickson. Kind of looks like Erickson, and it's certainly not Mahler. Mahler was a female. That's Aristotle. Why did I pick this slide? Well, I have no idea. The earliest model. Oh, okay, so we're going to talk about psychoanalytic therapy. The earliest model developed to treat mental problems was the psychodynamic theory. So this is the first one. And there's a reason why we're still talking about the psychodynamic model. It is necessary because uh, the psychodynamic model looks at what happened to you in your childhood that still affects you today. And a lot of times, and we're going to be dealing with this, a lot of times we're just trying to cure the symptoms and not look at the cause, the root cause. We're not taking care of the root cause of your problem. And sometimes that's okay, that's enough, and sometimes it doesn't work. You need to go back and you need to talk about what happened to you when you were a kid or when you're a teenager or whatever. So that's reality. So sometimes the psychodynamic theory is important. A lot of people don't like it. They don't like it because they don't like Freud. And the reason they don't like Freud is because they think he's a misogynist. Well, the reality is that Freud was a product of his time, and he lived at the end of the 19th century and through the beginning of the 20th century, died in 1940. Died of cancer, strangely. Well, that's not that strange. He smoked cigars all of his life. But yeah. So a lot of people don't like Freud, but you have to understand that in his day and age, when he first started looking at psychology, um, men were very dominant over women. The religions told them that men were dominant. The society did. Women weren't allowed to own property. I mean, it was really, really bad all around, all over the world. And it's still that way in some countries, not the United States, of course, but in some countries, it's the same. It's exactly the same as it was back then. Um, so a lot of people don't like Freud because, the whole feminist ideal is that he said that women had penis envy. That's the biggie. That's the huge point. Yeah, and most women go, I don't really envy a man's penis. And yeah, well, anyway, I think it's important to study Freud because Freud is who everybody else was arguing with, and that's why they came up with new therapy techniques. Otherwise, there would just be psychodynamic therapy. There wouldn't be, Adler wouldn't have come out. Gestalt wouldn't be there. Rogers certainly. Rogers actually was a psychoanalyst, and he realized, well, I need to help people quicker. Psychoanalysis is too slow for me. We need to do something else, and and Freud's idea was that men were wild animals that needed to be controlled by society. And Rogers felt that no, men aren't wild animals. Men are want to be okay. They want everything to be copacetic. They want everything to be even. It's society that makes us crazy. So there you go. So the reason we're studying Freud and the reason we're studying the psychodynamic model is because he was the first one, and he was the one that everybody changed therapy for because of. And they were arguing with Freud, even though he may have been dead. They were still arguing with his ideas, which is good. It's a good idea. I mean, if something's good, it's good. If something's bad, you need to talk about it. And I think what we have done with psychoanalysis is thrown out all the things that don't fit in today's society, but hopefully we've kept all the aspects that you can use, that you can utilize. I hope that makes sense to you. We threw out all the bad and kept all the good. So let's go ahead and talk about Freud. He developed psychoanalysis along with his colleagues in the 19th century. Psychoanalysis view presents mental problems as being caused by internal unconscious problems from the individual's development. So this is why your problem is here. And that's what he was seeing. He was seeing a lot of this. And the reason he was seeing a lot of this is because there was a lot of sexual repression at the time. It was a crazy world where if you were wealthy enough, you not only had a wife, but you also had a mistress. If you were a wife, you couldn't acknowledge the mistress. And if you were a wife, then you had babies until you went through menopause, and then you weren't supposed to enjoy sex. This was the Victorian era when sexual repression was societal in nature. And I'll tell you, I'm 75 years old. I can tell you that in the 1940s and the 1950s, sexual repression was still very, very active. And my mother talked about these things. My mother was a nurse, and she talked about sexual repression, and she taught us to be sexually repressed because that's what society wanted us to do. The only way to get along in society was to repress your sexuality. It was so bad that not only were you supposed to control your sexuality, but you were also supposed to control your reproduction. Society dictated whether you could reproduce or not. That's how bad it was. Condoms, you had to get a prescription for condoms. The pill wasn't around until the early 1960s. And the first birth control pills were really, really strong, and they caused a lot of problems they caused some problems for some women. And for that reason, of course, they were, a lot of people didn't want to use them. And society told you that you weren't supposed to have sex as frequently or think about sex as much as people seem to be thinking about sex. So a lot of the problems were unconscious. You had to repress all these ideas because the cause is unconscious. To get to the root cause of the patient's problem takes a great deal of therapy and a careful observation by the therapist. This was a real interesting problem. It sometimes took years. Freud's theories evolved during a time of a great deal of sexual repression in Europe, what we refer to as the Victorian era. Therefore, and the reason it was called the Victorian era was because of Queen Victoria. Queen Victoria was queen from like 1819 to 1890. She was a queen for like 70 years. And it was during that era when women wore clothes that didn't display anything. Um, they they wore dresses that went all the way down to their ankles. Men would get excited if they saw a woman's ankles or her wrists. Everybody wore gloves. They all wore veils. I mean, it was really a very repressed period. Therefore, Freud saw most of the humanities problems caused by by sexual repression. And if you read Freud, that's what you get out of it. Lots of sexual repression. In today's society, we're not nearly as sexually repressed as we were back then. but there is some degree of sexual repression that still exists. He was very much influenced by the work of Charles Darwin. He therefore saw humanity's need to reproduce, just as in any other animal, as our prime driving force. Abnormality was caused when the normal sexual drive got in the way of social convictions, forcing the individual to either do something that would be frowned on by social convention or deny their sexual needs. In most cases, the sexual needs are repressed, and the individual develops some form of pathology, usually some neuroses. Freud felt that each of us is born with our animal reproductive needs. This drive Freud referred to as the id. Id is a Latin word that means it. So this is the it of you. That's your sex drive. The id is made up of instinctual needs, drives, and impulses. The id's focus is obtaining whatever it wants. This is done through the pleasure principle. The drive that fuels us is our sexual energy or our libido. The libido will fuel our drive the rest of our lives. It's the sex drive that we have. It's our libido. The libido fuels the id through the initial stage of life, a stage that focuses on eating. So when you first have a baby, the only thing the baby's thinking about is, I'm hungry, or I need to defecate, or I need to urinate, but I'm hungry. So the baby's focus is not on controlling its bowels. It's not on controlling its urinary sphincter. It's on eating. So the first stage of development is the oral stage. At about the 18th month of life, social necessity forces the parent to force the child into learning social responsibility, and they have to potty train them. At this point, the ego must be developed. You've got to change. Before, anything you wanted. The id was in control. The pleasure principle was in control. But now all of a sudden, whoa, you got to pull in the reins, and you've got to become socially responsible. And in order to do that, you have to develop an ego. And the ego is that aspect of you. It's your unconscious drive that tells you the only way I can survive in this environment is to control myself. That becomes your ego, and it's run through the reality principle. Reality is that if I'm going to live in society, then I need to figure out what to do with my feces. I need to not wet my pants. Our first socially responsible act, of course, is potty training. Thus, our developmental focus is with depositing our solid and liquid, but mostly our solid waste in an appropriate receptacle. The anus is our second area of focus, and thus the anal stage is our next stage of development. The ego works by controlling the id's libido through ego defense mechanisms, and all these defense mechanisms begin in the anal stage. And these are the ego defense mechanisms. We have to repress. Repression is avoiding anxiety by not allowing painful or dangerous thoughts to become conscious. So we repress these ideas, these sexual ideas, these ideas that nobody likes, that people will go, oh, you're sick. You need to get away from me. That's repression. And of course, he was mostly talking about sexual repression, not so much anymore. Now we have other ideas, like, picking up a gun and shooting everybody in the room. We got to repress those feelings. Another ego defense mechanism is denial, refusing to acknowledge the existence of an external source of anxiety. If we close our eyes and go la 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 as much as we possibly can, then we can deny that something exists. We can pretend it doesn't exist. Denial. So we have repression, we have denial. We also have projection, attributing your own unacceptable impulses, motives, or desires to other people. And I have been married 3 times. I've told you this, or maybe I haven't. Anyway, I've been married 3 times. My first wife was having an affair. So what happened was, and I, of course, I'm totally clueless because I'm not real bright. So one day she came home and she started accusing me of having an affair. I couldn't figure, what are you talking about? I go to an all men's college. How could I possibly be having an affair? And as it turned out, she was having an affair with somebody, but she was projecting her infidelity on me because she didn't want to feel guilty. So she was projecting. Rationalization is another ego defense mechanism, intellectualizing a socially acceptable reason for an action that actually reflects unacceptable desires, and that's rationalization. And just like killing a fly with a hammer and punching a hole in your significant other's skull. Reaction formation, adopting behavior that is exact opposite of impulses they are afraid to acknowledge. And a good example is when I married my current wife, I went down to visit her parents, and they treated me so nice. They were really nice to me. The reality was, both of them were pretty angry because my wife was an officer and I was enlisted, and they thought I just ruined her career. But instead of treating me like they wanted to treat me, they had a reaction formation, and they treated me the opposite of the way that they wanted to treat me. Displacement is another ego defense mechanism, displacing hostility away from a dangerous object and onto a safer substitute. This is the famous boss yells at you, you come home, and you kick the dog. Why did you kick the dog? Because the boss yelled at you. Well, wait a minute. What does kicking the dog have to do with your boss? It has nothing to do with your boss. You can't kick your boss, so you kick your dog instead. That's displacement. Intellectualization or detachment. Individual suppresses emotional reaction by giving a flat, emotionless, overly logical response. And I'm intellectualizing right now. In the fall, I will probably not be teaching at Dene College anymore because Dene College has decided that all their instructors have to live on campus. So we have to be there, and I can't do that. So rather than get really upset and start screaming at everybody, I'm intellectualizing so I talk to you guys naturally without going, oh, please tell the administration to not fire myself because I can't come back to campus. I'm not doing that. What I'm doing is teaching my classes and being nice to my students and trying to be nice to the administration. It's not always easy, but that's intellectualizing. I'm trying to act like a professional, which is intellectualizing. Regression is retreating from an upsetting conflict by reacting in a more immature manner than your age, going back to a safer developmental stage. I have a really good example of this. My wife was stationed in Korea, and one of her friends was a newlywed, and her husband was a pilot, fairly high-ranking officer, and they had only been married for about a year, and she was in an isolated tour in Korea, and her husband was back in Texas, and she found out he was having an affair. And as soon as she found out he was having an affair, instead of anything else happening, she started acting like a kid. She started acting like a teenager. She would go into the officers club and she'd sit on guys' lap and she'd say, oh, give me a quarter for the slot machine, that kind of stuff. She started acting like she did when she was a young cheerleader in high school, when she was, before she was emotionally involved with anybody. So she started acting innocent. She went back to her innocent time when she was a cheerleader in high school. Regression. Sublimation, expressing sexual and aggressive energy in ways that are acceptable to society, painting, writing. A lot of writers do this. They sublimate. A lot of painters do this. Michelangelo was gay, and he couldn't express his homosexuality. So instead, he painted, and he painted for 18, 20 hours every day. Why did he do this? Because he couldn't express his sexual orientation. Sublimation. Introjection is the mechanism of maintaining the values and standards of others. During World War II, inmates in concentration camps would accept the control of the Nazis and become informers on their own people. They accepted the Nazi ideals, and they actually are the ones that controlled the concentration camps. They're in these Jewish inmates. Introjection. Identification with another individual to enhance one's self-worth. Joining an organization like the Ku Klux Klan or the White Aryan Nation would be an example of identification, overly identifying with somebody, adopting all their ideas because you can't deal with your own feelings. Compensation consists of masking perceived weaknesses and developing positive traits to make up for limitations. And compensating, I don't know what she's done to her nose, but evidently that's what she looked like afterwards. Between ages 3 and 5, after we become potty trained and our area of focus becomes our sexual parts, this stage of development is the phallic or the penis. Of course, phallic means penis, the phallic stage. During this stage, males go through the Oedipal conflict and females go through the Electra conflict. In this conflict, the child desires to control more than their opposite sex parent. This isn't a sexual thing, it is controlling the parent. So the little boys will attach themselves to their mothers. Little girls will attach themselves to their fathers. This is resolved by accepting the inability to compete with the same-sex parent and thus identifying with the same-sex parent. This is known as resolving the Oedipal conflict and results in the development of the superego or your conscience. So now we have developed, we had the id, that is us, as in an animal state, and then we have to develop the ego in order to control ourselves. And now we have the superego, which becomes our conscience. Because the child is now adopting the parent's values through identification with the same-sex parent, the superego is able to develop. The child will resolve the Oedipal conflict at about age 5 and pass into a period where there is little going on sexually, the latency stage, that lasts through age 12 when puberty takes place. Puberty triggers the individual's desire to have sex with the opposite sex, since they identify with the same-sex parent and they go into the genital stage. So it starts out as the oral stage because that is their area of focus. Then they have to potty train, so it becomes the anal stage. Next, it is the genitalia stage or the phallic stage, as Freud called it. Then the latency stage, when nothing's going on. And then finally, the genital stage. Now they're ready to reproduce. Freud felt that thought and memory that we could recall only amounted to about 10% of our total mind structure. The rest lay hidden into a rarely tapped mass known as the collective unconscious. To get glimpses into the collective unconscious, Freud relied on talking therapy, where hints of the unconscious would come out. The talking therapy that Freud used was free association, where Freud would allow the client to say anything that came into their head with minimal prompting from the therapist. In fact, the client faced away from the therapist to prevent any interruptions. A second technique was dream analysis, where the therapist interpreted the client's dreams. Dreams were unsuppressed glimpses into the unconscious. And if you have no control over your dreams, you dream whatever is going on in your head. And therefore, Freud felt that dreams were a window into your subconscious. Psychoanalysis often takes years because of the resistance in the form of ego defense mechanisms that clients use to stay away from unpleasant thoughts. We have developed these defense mechanisms, and in a lot of ways, defense mechanisms are good because defense mechanisms allow you to go through your day without dealing with past problems. So you repress it, you regress, you project, you're in denial, and that's okay because that at least gets you through your day. But if you're seeking therapy, you've got a problem that is a continual problem, then you will use these defense mechanisms in therapy to resist dealing with the problem because it hurts, it bothers you to remember these things. So you deflect, you use any technique, any defense mechanism that you have developed. The client will begin the recovery process by beginning to feel toward the therapist the way they feel toward the significant other, usually your parent that you're in conflict with. And that this is true because, well, you saw how much conflict there was going on. So it's normally a parent. It's either your mother or your father. It can be a parent figure that you had trouble with, that you're dealing with, and what happens is that you start seeing your therapist as the conflictual parent. And this is known as transference. You're transferring your feelings for your mother to the therapist. You're transferring the feelings for your father onto the therapist. That's known as transference. But you resist this through your ego defense mechanisms. As they relive the conflict that is causing them problems, the therapist can relieve the conflict because the client has transferred their feelings from the conflictual person to the therapist. Now, you have to remember that these problems that you have were developed when you had an immature mind, when you were 2 or 3 years old. And so you dealt with them as a 2 or 3-year-old. And now if we can bring them back, since you have transferred your feelings toward your therapist, if we can bring them back and we can bring them out, then you can deal with them as an adult. And you'll have the same feelings you would have had when the conflict arose because you have transferred your feelings to your therapist. And this is known as catharsis, dealing with your problem, working through your conflict is known as catharsis. But now you're dealing with it as an adult. It wasn't your fault. As an adult, you can see that. Your parents got a divorce. And now you can see that because, and it wasn't your fault. Why can you see that? Because you're an adult now. You understand it. I didn't have anything to do with that. But when you were a child, you couldn't see that. Okay, so that's psychoanalysis. Erik Erikson was a contemporary of Freud's and worked with him in Vienna toward the end of Freud's career. Actually, he worked with Freud's daughter, Anna Freud. He worked with her dealing with children. Erikson's specialty was teaching children. He had worked in the Montessori school in Italy, the original Montessori school, so he knew children. He had dealt with them before. While Freud worked with abnormal adults and based his theory on his observations, Erik worked with normal children and based his theory on normal children. Because Erikson's life was a continual crisis in the social aspect of his life, he saw life developing because of frequent social upheavals. Erik Erikson was blonde-headed and blue-eyed, but he was Jewish. He looked German, but he was actually Jewish, and that created lots and lots of problems throughout his life. The reason is because in Germany at that time, this is between the wars, between World War I and World War II, between the wars, the Germans were beginning to blame everything on the Jews. And because he looked German, the Jewish people weren't real happy with him. And because he was actually Jewish, the German people didn't really like him either. So he was kind of a persona non grata with everybody around him. And nobody was really happy with Erikson. So there were a lot of social crises that took place in his life. Erikson based his theory on the various life events that take place through normal development. The first crisis takes place during the first year of life and is a case of infant being taken care of as they want or being unable to trust their needs, that their needs will be met. And this stage is known as trust versus mistrust. Now, interestingly enough, Erikson's dad was a blonde-headed, blue-eyed Danish sea captain. However, his mother was married to somebody else at the time. So when Erikson was born and he came out with blonde hair and blue eyes, and Jewish people mostly have black hair and dark eyes, his father left. His father left the family because he knew that his wife had had an affair. So there you go, trust versus mistrust. So Erikson was told that this guy was his father throughout much of his early life, and then his mother married somebody else, and he thought, well, this is just a natural way of things. But eventually he found out, whoops, why do I look so different than all the other Jewish kids? Because I had a Danish father. The second crisis takes place between the first and the third year. During this time, the toddler is experimenting with self-reliance and seeking to pull away from their dependence on their parents. This crisis is known as autonomy versus shame and doubt. The shame and doubt comes from pooping your pants or peeing your pants. And so it has a lot to do with potty training, just like with Freud. But they need to be autonomous. They need to be able to take care of themselves. They need to be able to deposit their waste in the right place. The third crisis occurs between the ages of 3 and 6. The child is seeking the initiative to be independent of their parents or feel guilt over not being allowed to make their own decisions. And this happens in some families where the parents are overly protective. This crisis is known as initiative versus guilt. Do I have the initiative to do things on my own, or do I need somebody to tell me what to do? Initiative versus guilt. The fourth crisis occurs between the ages of 6 and 12. The child begins comparing themselves with others in school and either has the industriousness to keep up or feel inferior to their peers. This crisis is known as industry versus inferiority. And of course, this has this parallels the latency stage, where you're worried. You're not worried about sex. You're not worried about what you're worried about is, can you keep up with everybody else? The next stage is during the pubescent period, between the ages of 12 and 18. The individual is seeking an adult identity. They will either break their dependent ties with their parents and find their own identity, or vacillate between dependence and clarification of the self. This crisis is known as identity versus role confusion. And this is when people start smoking. This is when people start taking drugs. Why do they do that? Because they want to look adult. They want to be adult. And the way they do that is by taking on the trappings of adults. Boys will try to grow mustaches. Girls will hope that their chests grow so that they look like an adult female. The next stage occurs during the productive years of 18 to 35. The individual has to decide whether they will fulfill their urges of intimacy or maintain independence but isolation. This crisis is known as intimacy versus isolation. The next stage occurs during the time when the individual maintains the most competence, between the ages of 35 and 60. The individual must decide whether they will lead productive lives, achieving one's dreams, and feeling good about one's accomplishments, or spinning one's wheels. This crisis is known as productivity versus stagnation. The last stage is during the last years of someone's life. The individual looks back to determine if life has been personally worthwhile. The crisis is known as integrity versus despair. Therapists can utilize Erikson by determining whether part of the individual's problem is a staged developmental crisis. Erikson's theory is based on the making of choices. By analyzing the choices that have been made in the social context that they were made in, the therapist can determine if the client is having problems due to making poor choices during an earlier developmental crisis. Erikson is especially relevant in cases of overly protective or overly controlling parents. And I have a niece who had an overprotective mother, and she had some problems. She developed, well, people argue whether she has schizophrenia, bipolar disorder, or borderline personality disorder. I think she has borderline personality disorder, but I haven't been asked because I'm the dumbest person in the world, and just because I studied psychology doesn't mean that I understand her daughter. So they treated her with medication for schizophrenia, and it made her lose all of her teeth, and it destroyed her joints. Isn't that great? Anyway, overly protective mother. Margaret's mother lived vicariously through Margaret. Margaret's mother kept such close tabs on her that Margaret was not able to make any free choices of her own. Thus, Margaret never developed the decision-making skills for an independent life. Though intelligent, Margaret will never be independent unless she goes back and resolves earlier deficits from poor choices. And that's the way my niece is. my niece had a child at 18, which was okay. That was fine. The problem was that she couldn't live alone. She couldn't live by herself. She was married at the time, and the mother made sure that she drove the husband away so that she could still be with her daughter. Make sure that she continued to do the right thing. And then she was diagnosed with all these other personality problems, with these mental illnesses. She'd never been able to make a decision on her own. And to this day, she still doesn't make any decisions on her own. And her daughter, same way. That's the heroin addict. Jung, also a contemporary of Freud's, and in fact was chosen, well, he was a contemporary of Freud and chosen by Freud to be his successor. Jung had a falling out with Freud and developed a more spiritual concept of personality development than Freud's sexual groveling around in the muck with the pigs, as Jung said. Jung felt that each of us is a repository of the knowledge of our ancestors in the form of instincts. This ancestral information is embedded in our minds through archetypes, or positive symbols of who we are made up of. The person that we are and the collective ancestral memories combines to make the collective unconscious. Jung was interesting. Jung was from Switzerland, and he was from the German-speaking portion of Switzerland. Freud, of course, was Austrian, and he spoke German as well. That's why Jung joined the group. Jung's father was a Reformed Church of Switzerland, which is a Protestant group, and spirituality he was brought up with spirituality, and by golly, when he develops his own theory that is very similar to Freud's, no, it's not sex, it's spirituality. Why? Well, this was drummed into him all of his life. So we've got Freud, who developed. Freud actually admitted that he was treated like his mother's husband, except for the sexual part. As far as the mother was concerned, she treated him. He was her first boy. He was her first child, actually. She married a guy that was in his 50s, and she was only 16, and they had 6 children together. But the 51-year-old didn't pay any attention to his wife. He had other things to do. He had another family from another wife, and he didn't pay any attention to his wife. So Freud's mother treated him like as if he were her husband. Okay, so there were a lot of sexual things going on, um, but not really sexual. Sexual thoughts, but not sexual things going on with Freud. As far as Erickson was concerned, it was society that was the problem. It wasn't him. It was society that had all these crises, this whole Jewish German thing going on. With Jung, of course, it was the fact that he'd been raised that spirituality was the essence of life. So when he develops his psychodynamic theory, it fits with his teaching, spirituality. Jung felt that we have a genuine self that is a compendium of our separate self and our collective memories of past ancestors, and a self that we show to the outside world. The mask that we maintain to protect who we are is called our persona. This is what we show to the outside world. Jung also felt that not everything within us was positive. We inherited ugliness as well as beauty. This core dark side Jung referred to as the shadow. The shadow often comes out in dreams, but is usually repressed because of its socially reprehensible nature. Jung also felt that we have both a feminine side, an anima, and a masculine side, an animus. The modern interpretation of Freud is through self-psychology or object relation theory. Object and object relation theory refers to the object that an individual seeks to satisfy a need. Now, remember, I told you that Freud is rejected to some extent, especially by psychologists and therapists, mainly because we don't really use psychoanalysis as much as we did before. But I have used it in the past. I've used it in the past, and I had a friend. Oh, when I was going through my PhD, I had a friend that he was from Ohio, and he was working with inmates that were in prison because they had molested somebody. They'd molested a child. They had raped somebody. They were serial rapists, and they were trying to figure out what to do with these guys. They couldn't leave them in prison all their lives. That's not what they had been convicted of. I mean, you convict somebody of rape, it's not a life sentence. So they were trying to determine if they could let these guys out, and that was his job. His job as a psychologist was to look at these individuals, read their records, read their therapy, and determine if they had rehabilitated. And he asked me to help him, so I did that. And of course, the only way to do that, since Rogers doesn't deal with sex, and CBT doesn't deal with sex, and Adler doesn't deal with, nobody deals with sex except for Freud. So we had to use Freud's psychoanalysis in order to look at what caused their problem, where it came from, and whether they had rehabilitated to the point that we could let them out, or to let them out of prison. Usually, it had to do with paroles. They were trying to parole these people early because the jails were so full at the time. Anyway, we did, and it was really kind of fascinating. I had I don't know, I had ten clients that I had to look at. What's my point? My point is that a lot of people don't like. We have talked about why people don't like Freud because his theories come from the 19th century. Self or others or other refers to the significant person or things that the individual seeks to achieve gratifying needs. Modern psychodynamic theory is based on the development of our concept of the self, who we are, in context with our expanding awareness of others. People seek relationships that match the pattern of their earlier experiences. Thus, if a child grew up in an abusive household, they would seek to duplicate this pattern in future relationships. This is normal for them. An alcoholic parent is normal for them. Being ignored when you're a child because your parent's an alcoholic or a drug addict, this is normal for them. That's what they're looking for. So when they are seeking another relationship, they're seeking a relationship that has love that they understand. And the love that they understand may be physical abuse, it may be alcoholism. This is what they understand. And if you don't have that, then you don't really love them because that's the only love that they recognize. Non-abusive situations would feel unfulfilling because they did not receive the pattern of love that was established with their caregivers in their youth. If they were overly dependent or overly detached, they will seek these patterns in their relationships. And so it is a continuing cycle. And they can't break it because love equals some degree of abuse. Love equals some degree of being ignored and alcoholism. If you're not an alcoholic and you don't smile sometimes or don't hit somebody sometimes, then that's not love. That's the only way they can recognize love, because love comes from the way they were treated when they were a child. Mahler, this is Margaret Mahler, feels that the most important relationship for a child is the symbiotic relationship they develop with their maternal figure during the first 3 years of life. She felt that it was mom. It was mom, not dad. Of course, she's Hungarian. She was raised in the 1930s, where the father figure was out making money and wasn't part of the connection with the family. Not nearly as much. Okay, so it was always the mother. Mother stayed home. The self develops in 4 stages. It progresses from total fusion gradually through various degrees of separation. The first stage is normal infantile autism, where the child is so fused to their mother that they perceive themselves as part of the mother's parts. And the focus isn't on the person, but the parts as an entity. Your mother is you. You are your mother. At this stage, the infant can be discriminative, but doesn't understand differences so that they like everyone. They only like certain people, and they only like the people that they have attached themselves to. The mother most, maybe a sibling, the father a little bit because he picks you up from time to time. There are only certain individuals that you acknowledge as part of you, but primarily you are part of your mother. You're always being carried by your mother. And so that's how you see the world. Normal infantile autism. Mahler's second stage is called symbiosis and lasts roughly from the 3rd month through the 8th month of life. The child has a profound dependency on the mother, but the mother has become a person rather than a part that completed the infant. The mother has become a partner and expects a very high degree of emotional interplay with the mother. So this is through the 8th month of life when you start thinking about walking. The 3rd stage actually starts before the 2nd stage ends, at between the 4th and 5th month. This stage is referred to as the separation individuation process. The child seeks separation and differentiation as an individual, but at the same time will turn back to them for confirmation and comfort. The toddler will often show a dichotomy between dependence and independence, and the child will constantly seek confirmation in what they are doing. And this is the time when the mother has to let go. If the mother doesn't let go at this stage, now we got problems. If they're overly protective or if they don't pay enough attention to the child, now we've got a problem. Children who do not idealize others while taking pride in themselves may suffer from narcissistic character disorders and have problems with self-esteem. Narcissism is characterized by a grandiose and exaggerated sense of self-importance and an exploitative attitude toward others. However, this persona actually hides a frail self-concept that the individual must protect because it cannot withstand scrutiny. These individuals seek attention and admiration from others. They exaggerate their accomplishments and tend to be fairly self-absorbed. They tend to be shallow thinkers and almost parasitic in their relationships. Unfortunately, no matter how much attention they get, it cannot fulfill their need for feeling good about themselves, and they can only maintain a sense of emptiness and deadness. The problem is that their relationship with their parents was superficial, and because of that, they seek constant admiration. But it was always superficial, it was always empty, and now that's the way they feel. No matter what they get, they still feel empty, and they treat others like they don't deserve to be treated with emotion. Why? Because they weren't treated with emotion. I hope all this is making sense. Their parents treated them like they were the king of the castle, the queen of the castle, but the reality was that they didn't show them any emotion. They just gave them things, but didn't hug them, didn't say anything to them. And now that's the way they treat everybody else. Like they deserve everything. Gimme, 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 gimme. I don't have to be loyal to you. That's narcissistic personality disorder. Borderline personality disorder is also rooted in this stage of development. They seek separation from their mothers, but are thwarted by maternal rejection of their individuation. Because of the mother's own needs to be totally needed, when the child seeks to separate, the mother does not support their separation. Borderline people are characterized by instability, irritability, self-destructive acts, impulsive anger, and extreme mood shifts. Kernberg sees them as lacking a clear identity, lacking a deep understanding of other people, having poor impulse control, and the inability to tolerate anxiety. And that is my niece. Okay, so narcissism and borderline personality disorder come from the separation individuation process in the eighth month to their toddlerhood. The fourth and last stage is characterized by a movement toward constancy of self and their significant other. Traditionally, this is their mother, and usually punctuated by the terrible twos and resolved by the age of 3. If allowed to separate by their mother, they will have no problem dealing with other people without fear of losing themselves. Codependency. At this time, they should have a firm idea of who they are, and the terrible twos are a good time because this is when they become individuals. And it's okay for them to cry. That's what you want them to do. You want them to find themselves, to be their own people. And this is what did not happen to my niece. Borderline and narcissistic disorders tend to be rooted in separation individuation stage, but don't manifest themselves until early adulthood. Symptoms include grandiosity and splitting. Splitting is a defensive process whereby the individual talks of themselves as two distinct beings, the projected persona and a bad person. The individual may refer to themselves in the third person when speaking of the unwanted or incompatible personality traits. So how do we treat borderline and narcissistic disorders? It comes in three phases. The first phase looks at the early interaction with parents as if affected personality development and may have resulted in problematic adult relationships. Let me read that again. That didn't make any sense to me, and I said it. The first phase looks at the early interaction with their parents as it affected personality development and may have resulted in problematic adult relationships. So in order to fix this, we need to go back to how your parents treated you during this, when you were pre-linguistic. That's what we need to look at. It is important during the initial level of treatment that the therapist develop a rapport with the client. They must listen to and understand the stories that the client tells and perceive them through the eyes of the client. And usually what we're going to get, this is when they were pre-linguistic, so they don't really remember what was going on at that time. They just remember how it manifested itself later on when they became linguistic, later on when they became older. The therapist must be supportive, and the counseling sessions must be explorations in feelings of acceptance and safety. So because they don't have this basis from their childhood, now we're going to have to take them all the way back to their childhood and give them the ability to be their own person. We're going to have to go through at least the last two phases. The second phase involves fusing past with the present. From the initial interviews and understanding of the past, the therapist ties present difficulties with past developmental problems. The insight often will create a flood of subsequent painful memories that the client has been repressing. By releasing these repressed ideas that played against their feelings of self-worth, often the client's perception of themselves changes. By reviewing adaptive mistakes in the past, they often acquire new and adaptive ways of thinking, feeling, and coping. They become proactive and in improving their present existence. This process of cognitive restructuring fosters emotional growth and allows clients to assume personal responsibility for their present decisions. Now, this is really kind of strange because this is what the therapist was trying to do with my niece. And my sister-in-law didn't like it. So what she did was she found another therapist. And when they started doing this, she dumped that one and found another therapist. She didn't want this to happen because she didn't want to lose her daughter. She didn't want to lose control over her daughter. With the client well on the road to recovery, but what has to happen is they have to develop selfness. They have to realize who they are. They have to become a new personality. They have to develop this new personality. Now, if it's borderline personality disorder, you may still have a mother that is still encroaching on the child's life. And if that's the case, you may not be able to get to them because the mother will separate them from the therapy. So we're not really going back to when they're 2 months old and 3 months old and didn't get what they needed. We're really going back to when they were 2 years old and 3 years old and 4 years old and 5 years old and 15 years old, and the way they were being treated at that point. And we can go back and we can say, well, this is what should have happened. And by doing that, they'll go, yeah, I guess that's what should have happened, and that this is how I should have reacted to it if I had been an adult at 2 years old and 3 years old and 5 years old and whatever. Okay. The client is well on the road to recovery. The therapist can begin phase 3. The therapist assigns homework and utilizes behavioral techniques and goal setting to maximize change. This is the time when the client, just as they should have done as a toddler, tries new behaviors based on their insights, understanding, and cognitive restructuring, using the therapist as a safe base. The client achieves empowerment and the therapy is terminated. Once they achieve uh, once they achieve empowerment, once they feel like they can do things on their own, once they start doing new things. The two therapeutic goals of Freudian psychoanalytic therapy are to make the unconscious conscious, to bring out what is causing your problems, and to strengthen the ego so that the behavior is based more on reality and less on instinctual cravings or irrational guilt. Successful analysis results in significant modification of the individual's personality and character structure. Therapists use the therapeutic methods to bring out unconscious material. Childhood experiences are reconstructed, discussed, interpreted, and analyzed. There is a deep probing into the past to develop the level of self-understanding that is assumed to be necessary for a change of character. The therapist is seeking insight into their client. It is critical that the feelings and memories associated with self-understanding be experienced. And that's okay. It's okay for them to cry. It's okay for them to yell. Why? Because we're trying to get them to relive these experiences as an adult so that they can deal with them. Sorry, I needed a drink. Classical analysts tend to adopt the classical blank screen persona while doing the therapy. By not projecting a strong personality or any personality to speak of, their neutrality tends to allow the client to project whatever they want to on them. This is usually referred to as a transference relationship, since the therapist has disclosed little to no personal information, allowing the client to transfer their feelings for their significant figures onto them, usually one of their parents. Often clients are unable to express love, do not have self-esteem to be able to work effectively, and feel too much guilt to play. The therapist's task is to assist the client in achieving self-awareness, honesty, and more effective personal relationships. In order for therapy to be effective, the therapist must first establish a working relationship with the client. The therapist then does a great deal of listening and interpreting. The therapist must become attuned to the client's method of constructing resistances. Understanding the resistances, the therapist will mostly listen until they detect the resistances blocking the process of the client's progress. Remember, the resistances are created by the ego defense mechanisms. At this point, the therapist can intervene and inform the client of their resistance. Typically, a client will come to therapy several times a week for 3 to 5 years. That's a lot, and it's expensive. Initially, the therapy was face-to-face, but eventually the client will begin laying on the couch and free associating with no interruption. The client will receive no outside stimulation from the therapist, and because they are facing away from each other, they will not be able to respond to the facial expression of the therapist. Clients are asked not to make any life-altering changes during therapy. Such occurrences can throw a therapy session into present problems and undermine all the progress that a therapeutic pair have experienced. Therapy progresses when a client transfers their feelings and fantasies about a significant person in their past onto the clinician and resolves their unfinished business by dealing with it with the therapist. She's transferring it. I'm not exactly sure what that means. Clients will regress emotionally and project upon the therapist the depth of feeling that they have for their conflictual other, usually their mother or their father. Strong emotion can be attributed to the therapist from hate to adoration. The transference must be worked through for the therapy to continue to progress. Exploration of unconscious material and defenses from childhood must be explored and evaluated for resistance. Because the client was working through these problems again, they are able to make new choices. The client is able to see how the defenses that they have adopted to cope with their conflict becomes a barrier in daily life. For the client to become psychologically independent, they have to recognize that defenses cause their behavior to be motivated by infantile strivings, such as needing total love and acceptance from parental figures. It is at this point that for therapy to take place, transference has to take place and resolution achieved by the therapist and client in lieu of the client and parent. Conflict can arise if the therapist's own conflicts brought out with their own personal therapy sessions are projected on and distort their client's conflicts. This is known as countertransference and occurs when a therapist has not been able to resolve their own development with their present. And I've talked about this before. Sometimes you got so many problems of your own, you really can't become a therapist because you're going to start projecting your problems on your clients, and that's not going to work. It's known as countertransference in psychoanalysis. Malcolm came to therapy because of an unresolved love conflict with his mother. His mother was cold and rejecting, and Malcolm continued to seek love from her even after her death. In therapy, Malcolm began to transfer his love need for his mother onto his therapist, Juanita. Malcolm, normally a very independent fellow, became dependent on Juanita for acceptance. Juanita had been a counselor for 6 years and in that time had never been able to deal with her own needs to be needed. When Malcolm started to become dependent on her through transference, Juanita allowed it to continue without resolution because of her own need to nurture. Malcolm continued to go to therapy because of his dependence issues much longer than he needed to because she kept waiting for Malcolm to resolve his dependence issues while it was her issue that required the resolution. Modern psychoanalytic therapy is different from traditional psychoanalytic therapy in several ways. It is geared more to limited objects than restructuring the client's personality. The client is less likely to lay on a couch. There are fewer sessions. There are more instances of supportive intervention. There is more focus on pressing practical issues than on working with fantasy material. Modern therapy techniques. The 6 basic modern psychodynamic techniques include maintaining the analytic framework, free association, just like in the past, interpretation, dream analysis, just like in the past, analysis of resistance, analysis of transference. The reality is all 6 of those are the same as in the past. Maintaining the analytic framework refers to accomplishing the goals of this type of therapy, including analyst relative anonymity, regularity and consistency of meetings, starting and ending the sessions on time. Time. Once again, it's time. The structure, I'm only laughing about that because I have colleagues that think that I need to put time restrictions on all of my assignments for you. And I've had this argument over and over again. It doesn't matter. I'm almost done. I can fight him off for another couple semesters. Don't worry. I'm not going to start saying, hey, if you don't have this in by midnight on the 27th, then you get an F. I'm not going to start doing that. The structure and regulation of the sessions becomes a powerful symbol of the regulation of infancy. And I must be an anal expulsive because, I think this is silly. But there are a lot of people that run their lives through with their clock, as strange as that seems to me. It can reflect the regularity of the infant feeding schedule, and the mere regimentation itself can arouse a great deal of emotion. Analysts try to minimize departures from this consistent pattern. Maybe that's my problem. Maybe I'm an anal expulsive, and my mother was an anal retentive, and she tried to put me on a schedule. Maybe that's my problem. Free association is central in the process of analysis. Saying whatever is painful, silly, trivial, illogical, or irrelevant allows the feelings and thoughts to flow without censorship. When feelings or thoughts are blocked, it represents resistances that can be used to break down the client's ego defense mechanisms to get deeper into the unconscious. Often it isn't what the client says during free association, but what material the client blocks that is important. The therapist is continually seeking blocks and slips of the tongue to discover what areas the client is trying to hide. And this can be important. And this is a joke. It may be a free association session, but it will cost you 75 pounds plus VAT. And I'm not sure what VAT means, but I sure know what 75 pounds means. That's about $150, $200. Interpretation consists of the analyst pointing out, explaining, and teaching the client the meanings of behavior that is manifested in dreams, free association, resistances, and the therapeutic relationship itself. Interpretation is grounded in the therapist's assessment of the client's personality and factors in the client's past that contributed to their difficulties. In making an appropriate interpretation, the therapist is guided by a sense of the client's readiness to consider the new information. I really like this. This is the therapist, and she's got all these thoughts and problems, and she's winding them up into a ball. The purple one's here, and the blue one's there, and the black one's over there. General rules of interpretation. Interpretation should be presented when the phenomenon to be interpreted is close to conscious awareness. They are dealing with new material, but material that the client is capable of dealing with. Interpretation should always start at the surface and go as deep as the client is able to go. It is good to point out the resistance or defense before interpreting the emotion or conflict beneath it. This is how you've been blocking this. You've been using denial. This is how you've been blocking this. You've been using rationalization. This is how you've been blocking this. You've been projecting on somebody else. Dream analysis is an important procedure for uncovering unconscious material and giving the client insight into some areas of unresolved problems. During sleep, defenses are lowered and repressed feelings surface. During dreams, an individual's unconscious wishes, needs, and fears are expressed. However, some motivations are so unacceptable to the person that they are expressed in disguised or symbolic form rather than being revealed directly. Dreams have two levels of content. Latent content consists of hidden symbolic and unconscious motives, wishes, and fears. Because they are so painful and threatening, the unconscious sexual and aggressive impulses that make up latent content are transformed into a more acceptable form. The more acceptable form is the dream's manifest content, or the way the dream appears to be to the dreamer. Sometimes an analyst will have a client free associate to the manifest content of a dream for the purpose of uncovering the latent content. When we're talking about latent content, usually it's sexual content, and usually it's content that you don't want to deal with, you don't want to think about. Freud was really kind of interesting. Anything that was long and pointed, he said it was phallic. It was the symbol was that it was a penis. Anything that was a door, a window, anything that opened, anything that you could go into, that was a vagina. As curious as all that is. Now, thinking about the last dream you had, I'm not sure how sexually repressed we are today, but of course, sometimes that's the way it worked. I had a dream the other day that I was trying to get through into an attic. And so I opened, it was a little door. It was a door about 3 feet tall. And I opened the door and it was just all a mess in there. There were newspapers and all kinds of stuff. So in order for me to get to where I wanted to go, I had to sweep all that stuff aside. And then just before I got it cleaned out, where I wanted to go, the person came out, two people came out of that place. And thinking about it right now, I think I have an idea what that what that dream actually meant. It wasn't about an attic, and it wasn't about. It was about something else. Okay, now I figured it out. Okay, dream analysis. Resistance is anything that works against the process of therapy and prevents the client from producing previously unconscious material. The material that is being blocked is usually material that is being repressed, and so the individual will try to steer the therapist away from delving into the subject area. That's what I'm doing with my dream, because I just figured out what it meant. The therapist must point out resistances to make the client aware that their attempts to hide painful information from the therapy process. Resistance need to be confronted as dynamics that prevent the client from accepting change and so need to be dealt with. Transference takes place when the client thinks of the therapist the way that they do the significant person with which they are having the conflict. Transference situation is considered valuable because its manifestations provide clients with the opportunity to re-experience a variety of feelings that would otherwise be inaccessible. Through appropriate interpretations and working through these current expressions of early feelings, clients are able to change some of their long-standing patterns of behavior. Okay, so let's go through this whole process. Let's talk about Stan. You remember Stan. We talked about him in the last chapter. 25-year-old construction worker. He has a hard time getting along with people. He's a self-professed loner. He can't get close to people. He drinks too much. He uses alcohol to cope with his life. He's intimidated by the intelligence of others, especially women. He wants to turn life around by going to college and becoming a counselor. Part-time student studying psychology. He's embarrassed about being behind his peers. He's obsessed with what people think of him. He wants to be a counselor for kids in trouble. He fears people his own age, is comfortable with children. Drinking makes him feel good and then guilty. He has done heavy drugs and still partakes in drugs from time to time. Especially feels overwhelmed by strong and attractive women. He fears that women will detect that he isn't virile. He sees himself as sexually inadequate. He feels anxious much of the time, especially at night. He fantasizes about committing suicide. A couple of feeble attempts at suicide 2 years ago. He feels rotten about himself, depressed. Feels that he has never loved anyone. A significant person in his life was a youth counselor from camp who helped him. He's been married and divorced. His wife was a strong, dominant woman. She was always telling him about how worthless he was. He and his wife met in Las Vegas. They only had sex a few times because he was impotent. Fears that women will swallow him up. He had a strong and dominant mother. He was the black sheep compared to perfect siblings. He was always in trouble as a youth. His father called him dumb and compared him to his brothers. He kept calling him a mistake. In his life, there was no talk of religion or sex as a child. He's filled with anger and hate as a child. He wants to feel better about himself. He wants to stop drinking. He wants to lose his fear of women. He wants to lose anxiety and guilt. He wants to become a good counselor. So what are we going to do as far as psychodynamic, the psychoanalysis is concerned? The focus with Stan is on the repressed anxiety related to the threat and breakthrough of his sexual and aggressive impulses. He's always had to rigidly control these impulses, and when he did not, he got into trouble. He had to develop a strong superego by interjecting parental standards and values and making them his own. These aspirations were unrealistic because they were perfectionistic goals. Thus, he could be loved only if he were perfect. Yet no matter what he attempted, it never seemed adequate. Stan internalized his anger and guilt, which became depression. Thus, his self destructive impulses are a way of inflicting punishment on himself. Instead of directing his hostility toward his parents and siblings, he turned it inward on himself. And this is usually the way suicide works. Suicide usually comes from other people persecuting you, and therefore you start persecuting yourself. Eventually, you get to the point that you become self destructive. Stan's drinking may be a manifestation of an oral fixation. Because he never received love and acceptance in early childhood, he is still seeking it by drinking. Stan's sex role identification was fraught with difficulties. Stan learned the basis of male female relationships through his early experiences with his parents. What he saw was bickering, fighting, and discounting. His father was weak and his mother was strong. His mother was able to hurt men. Stan identified with his weak and impotent father. He generalized his fear of his mother to all women. He married a woman who was similar to his mother, who reinforced his feelings of impotence. For transference to take place, Stan will have to relate his therapist to his mother. This should give Stan insight into his most serious problem, his fear of women. In dealing with his past, he explores his relationships with his siblings, mother, and father. He re experiences old feelings and uncovers buried feelings related to traumatic events. He explores how has generalized his view of women and men from his view of his family members. Questions the therapist might ask Stan: what did you do when you felt unloved? What did you have to do as a child with your negative feelings? Could you express your rage, hostility, hurt, and fears? What effect did your relationship with your mother have on you? What did this teach you about all mothers, all women? Stan comes to understand that he has been shaped by his past experiences. With this insight, Stan is able to exert control over his present functioning. Many of Stan's fears become conscious. Because his defenses are no longer protecting his unconscious fears, he is able to make new decisions about his current life. Stan will only be able to work through his problems to the extent that transference takes place. Superficial transference, superficial solutions. The focus of the therapist with Stan will have to be Stan's developmental sequences. The focus should be on the fact that Stan's current behavior in the world is largely a repetition of one of his earlier developmental phases. This dependence repeats a behavior pattern formed with his mother during infancy. Stan has not accomplished separation and individuation. He is unable to obtain his confirmation of worth from himself, and he has not resolved the dependence-independence struggle. How much interest would you have in Stan's early childhood? And the question is a lot. How might you react to this, to his making you into a significant person in his life? And without it, he's not gonna be able to repair himself. In working with Stan, what countertransference issues might arise for you? And of course, if you had a similar life to Stan, then their countertransference is a possibility. And each of you will have to answer this question for yourselves. What resistances might you predict in your work with Stan? Okay, this is one. Remember, I told you I was working with a friend in Ohio. I was actually in Texas, wasn't I? Yeah, I was in Wichita Falls, Texas, and he was in Ohio, and we met because we were both working on our PhDs. Anyway, this is another situation. He told me this story. This is Muffy. Muffy, and that was actually her nickname. That wasn't her name. I can't remember. It started with an M. It wasn't Muffy. But this is the name that her dad gave her, okay? Muffy was the last of three girls in a six-child family. Muffy had two strong parents. After Muffy was born, her mother decided that she would no longer have sex with her husband. Muffy grew up being Daddy's little girl. All Muffy had to do to get anything from her father was to ask him. When she went through puberty, she would flirt with her father and get anything that she wanted. Muffy learned early that she was very attractive and that she could use her good looks to succeed where others had to work for what they wanted. In school, she never did any work, but was passed along anyway because she was so cute, and when she got older, was very attractive. She learned early that men give you things because you are pretty. When Muffy was 12, she was molested by her father's favorite brother. When she told her father, he laughed and said that it was all right, just stay away from Uncle Jake. At 16, she was married to a man who was attracted to her sexually but didn't give her much affection. She was able to keep the relationship together by doing his sexual bidding. Muffy worked as a bartender at a topless bar and then eventually as a stripper. Muffy's husband quit work and lived off the money that Muffy made. Muffy first sought treatment as a victim of physical abuse. Her husband had tried to give her to a group of friends of his, and when she balked, he beat her up. In therapy, Muffy talked about going back to her husband when he got out of jail. During therapy with a male therapist, Muffy began openly flirting with him. This is how she got along with men. She flirted with them. And because she was so cute, because she was so pretty, she got away with stuff. This is the way her life always worked. The therapist started working with her because she would come in with her husband. Her husband had a problem. I think it was he had molested somebody. And Muffy would come in with him. Eventually, her husband was incarcerated for an unrelated crime, and Muffy came in to see the therapist because he was the only man who was ever nice to her and didn't expect something in return. Muffy's problems were all sexually related, so the counselors decided to use psychoanalysis with her. Because she used men by enticing them with her sexuality, a female therapist was chosen to work with her. Delving into her problem, it was discovered that her basic problem was with her mother. Since her mother was basically absent from her life, she was never able to work through the Electra complex and identify with her mother. Muffy grew up identifying with her father and being rejected by her mother. Her overt sexuality became like every guy's fantasy because she had no tempering femininity to dictate proper behavior. Her problems were fairly simple, and on the surface, she sought attention from her mother and she acted out overt sexuality to achieve condemnation from her, but she got no response. She married a man who was a reflection of her father. When she was naked around men, it was like a man taking a shower in a room full of other men. It doesn't mean anything. She didn't mind being the breadwinner in her family. When her husband offered her to other men, he lost his protective father status. Therapy for her was actually fairly rapid. Her sexuality was not repressed, but her need for a mother figure was was a painful aspect to reveal. Transference with the therapist was not a problem. The female therapist was literally the first female friend that she had ever had. Muffy was almost a walking dumb blonde joke. After transference, the therapist was able to build self-esteem in the young lady, and she was able to find an intellect that she had always repressed. She had thought that because she got stuff, because she never had to work in school, that she was unintelligent. But the reality was that she was intelligent. She just never applied it. And that's one of the reasons why she got married at 16. She didn't appreciate school. She didn't appreciate learning things. So she didn't think that she had an intellect and that she needed to get out of school as quickly as possible before somebody figured her out. Muffy was found to be suffering from fairly severe codependency. When she allowed herself the right to be her own person, she stopped displaying herself to keep men interested. She had said at one point that her greatest fear was bringing a child into this world because she saw herself as a pornographic picture. As long as you were looking at the picture face on, there was a person, but when you turned the paper on its side, the person no longer existed. She didn't want to bring forth any invisible children like her. Since Muffy lived a life that was most men's fantasies, her dreams mostly dealt with overt sexuality. Since she had never learned social repression to any significant degree, her dreams tended to be erotic but not sexual. Most of her visions were masturbatory. Though the women tended to be two-dimensional, only the males were three-dimensional. While she smiled constantly in real life, there was no joy in her dreams. After resolving the conflict with her mother therapist, she was able to identify with society's definition of a female. Suddenly, her husband was not attractive to her anymore. She divorced him, she gave up stripping, and finished her GED. She went to college to study radiology. She eventually remarried and was expecting at last contact. There you go, happy story. And it worked. And all they used was psychoanalysis with her. And it was a success. Tim is incarcerated for child molestation. He is being counseled in an attempt to stop the cycle of reoffense and incarceration. Tim's mother was overprotective and overpossessive and controlled him with guilt. Even now, she reminds him of all she gave and sacrificed and how he was a difficult child from birth on. She almost died delivering him, and she tells him that she has been suffering because of him for many years. Tim was the only boy in a family of 5 children. Psychosexually, Tim decided to become a neuter in an effort to become what he thought his mother wanted him to be. He became quite overweight, developed a passive and unassertive style, especially with women, and has avoided developing lasting relationships with women for 50 years. Tim saw his father as being extremely weak and uncaring. He reports that he cannot remember any events in which he and his father did anything together. His father showed no interest in him, and his typical way of dealing with Tim was to ignore him. His father was controlled by Tim's mother and his grandmother, each fighting to run the house in the way that she saw fit. They had very different ideas of what the family should be, so conflict was a continual pattern in the home. Things Tim did to please his mother often upset his grandmother, and the reverse happened when he tried to please the older woman. As a child, Tim envied his sisters because he thought they were treated more fairly than he was. Eventually, the discriminatory treatment that he felt was receiving changed his envy to resentment. He grew to fear women who were older than he, for he continually felt that they could and would dominate him. His relationships with others had been inadequate, and he has never been able to form and maintain satisfactory relationships with adults of either sex. Tim discovered that he felt relatively comfortable around small children, especially boys. They seemed to take a liking to him, they did not make demands on him, and he did not feel inadequate around them. For a while during his early adult life, he worked as a teacher's aide in an elementary school. He began his pattern of molesting young boys in this job. He would invite some of these children to climb on his lap, and he would then stroke their hair and cuddle them. Eventually, he progressed with several boys to the point of touching their genitals. He also encouraged them to touch him. His pattern continued, and eventually he was arrested. During the rest of his adult life, Tim has been in and out of state hospitals for sex offenders for a number of times. When he finishes his time, as stipulated by the court, he is released, goes into the community, and then reoffends. He feels that he never hurts his victims and that he is typically very nice and kind to them. He even rationalizes that they often enjoy the attention and physical affection that he demonstrates. Yet at times he also feels that what he does is wrong and he feels guilty over his deeds. He does not think that his actions are normal, yet he worries about how he will deal with the impulses he might feel towards certain children. He has made resolutions to control himself, yet he has often acted on his impulses. He says he would like to learn to control his desires and be able to relate well with adults. And that is it. The reason I gave you Tim is because this was one of our cases. And so you may ask yourself, what did we do with Tim? What we did with Tim was send him back to the hospital. We didn't think we could release him on society. And he didn't seem to want to help himself. He didn't try to do anything to help himself. And he was trying to punish his mother. And there was no resolution. And she certainly wasn't helping. Anyway, there you go. That's the end of that. Now, you saw how we dealt with Stan and what we did with Stan. So what you need to do is you need to look at the individual that I have created. This is not a real person. This is not a real situation. I have manufactured it. The guy's name is Mordor Lufkin, and he's a 28-year-old working on the Navajo Nation as a surveyor. And you will read all about Mr. Lufkin in the discussion. What I want you to do is come up with, wait a second, what do I want you to do? I want you to answer these questions, wherever they are. Somewhere, there they are. Okay, I want you to come up with some kind of a treatment plan. What is it that you're looking for? The other thing you need to do is determine if these goals are doable. Yes or no will work. Then you need to talk about his symptoms, your diagnosis of what his problem is, what stressors he has in his life, identify his stressors, identify his strengths, and whether prognosis means what you expect to happen in the therapy. What is the prognosis? What's the probability that he's going to be able to change? In the prognosis of Tim that we were just talking about, the prognosis was poor. He really didn't want to change. His mother liked him the way he was. She'd created this person, and she wasn't going to do anything to help. So his prognosis was poor, and that's why we left him in the mental hospital. In the case of Muffy, her prognosis was pretty good. All we needed to do was get her away from her husband, and it wasn't it wasn't us that got her away from her husband. It was he committed another crime and went to jail. And then she came in for treatment, or she came in for therapy, and she may have come in. Something I didn't tell you about my friend. Yeah, he was a very attractive man. He had been a stripper. He'd been a male stripper, and I thought that was kind of funny. Anyway, that and that was kind of strange too. So here we're in this whole crowd of people, and I don't know. We sat in a round area, and people were talking, and everybody stayed away from this guy. And I couldn't figure out, what in the hell's wrong with this guy? How come nobody wants to talk to him? The only person that was talking to him was his wife, and she kept leaving. And so I went over and I started talking to him, and he was a really interesting person, but I couldn't figure out why nobody wanted to talk to him. And eventually, well, it didn't take very long to figure it out. women were intimidated by him because he was so good looking, and men were intimidated with him because he was so good looking. And you've seen my face. I'm not intimidated. Why would I be intimidated? I was older too, so that may have had something to do with it. And I felt kind of sorry for him because nobody would talk to him. And that's how we got into our conversation. And that's one of the reasons why I got to help him. It was fascinating, just fascinating work. Anyway, so next week we'll tackle Adlerian therapy. Good luck with Mordor Lufkin, the 28-year-old surveyor. Okay.